This video is for educational and conceptual purposes only. It does not constitute medical advice, diagnosis or treatment. Please consult your healthcare provider before making any medical decisions or changes for your treatment plan. Thank you. Hello and welcome. Today we will explore how integrative and conventional medicine can work together, and specifically how to possibly support the heart in converting atrial fibrillation back to sinus rhythm and to minimize the long-term side effects of amiodarone treatment. To understand how these two systems can truly collaborate, we need to look at amiodarone from a different perspective. Its effect on the structured water grid, the same subtle matrix that may serve as the operating platform for nature's pharmacy, also known as phytochemistry. By walking this integrative path, we can open new concepts and begin to explain vague but important clinical symptoms such as unexplained excitability. Our model is based on structured water grids surrounding cell membranes as seen above. Emotional trauma can deform this grid, leading to a loss of coherence and disrupting the proton battery and its connection to zero-point energy access. This may result in disorganized excitability, manifesting as arrhythmias, swelling from structured to bulk water transition, or pleural effusion. So the first step is understanding the role of structured water associated with lipid membranes and the bioelectric and biophotonic currents flowing through it. In our integrative model, this is what traditional medicine calls Qi, the intelligent bioelectricity responsible for communication, cooperation, and coordination during embryonic development and adult life alike. Additionally, this water grid dissociates protons above it, creating an electrical potential gradient that powers biological processes. This may shift our attention away from mitochondria as the central players and toward the microtubular membrane extracellular matrix system, with mitochondria acting simply as fuel sources to help maintain water coherence, while consciousness locally collapses the proton battery through targeted intention, also known as Fröhlich condensates. If this is correct, it may even help explain memory formation. In this model, memory is not only encoded and retrieved in the brain, but also stored in the internal membrane complex, written in what we call field language as holographic imprints. This may support traditional medical frameworks that associate each organ with its own emotional frequency. In our case, the heart with love and conscious integration. We are all familiar with the classical model of congestive heart failure. So what can we meaningfully add to this framework? If we accept the possibility outlined on the previous slide, that the heart plays a central role in love and conscious integration, and that the lungs are associated with external boundaries through the angiotensin converting enzyme system running just under the skin and present in the lungs as well, then another model begins to unfold. A quick internet search reveals the condition Takotsubo cardiomyopathy, often described as myocardial stunning or after sudden loss of contractility after emotional shock or tragic loss. In some cases, this may be accompanied by pulmonary hypertension resulting from a contracted lung field. So not only the heart loses its contracting ability and inotropy, but the lungs may also become contracted, so their field becomes broken. A collapse of the electromagnetic structure following bereavement. Of course, this is typically a diagnosis of exclusion, but in the absence of a long-standing history of smoking, dust exposure or chronic lung disease, this field-based interpretation can be valid. A side note, this kind of localized electromagnetic collapse triggered by emotional overwhelm may also initiate chronic fibrotic lung disease or smoking-related pathology in certain individuals, though those conditions are clearly more complex and degenerative in nature. Obviously, they may start as a sudden acute collapse of the lung field, for example, at the beginning, and after that smoking will complicate the picture. When the electromagnetic field in the heart or any organ becomes weak, there is a rescue mechanism described in traditional medical systems. It is known as liver qi invasion. Here is our possible interpretation. In our model, the liver acts as an electromagnetic backup generator. It has a high mitochondrial density, rich blood supply, and fascia connections to nearly every organ in the body. When the heart is overwhelmed, whether by emotional or toxicity, its mitochondria may fail to sustain the local magnetic field. This triggers a compensatory response. The liver sends energetic support to stabilize the heart field. But this is an emergency solution only. It does not address the root causes, which are often unresolved traumas, toxins, or emotional burdens. Externally, we might observe signs such as palpitations, arrhythmias, disturbed sleep, or wiry pulse, or other liver-associated symptoms. Acid reflux, poor appetite, headaches, or emotional reactivity. These may reflect the liver's attempt to digest the emotional overload and manage the overflow of charge through the fascia network. When the lungs are overwhelmed by loss, their mitochondrial and facial field becomes weak and can no longer maintain the structured water grid. The system collapses into bulk water, resulting in pulmonary oedema or pleural effusion. To manage this, the body may discharge the excess fluid into the pleural space, and this happens for three main reasons. First, to contain the vibrating trauma field, isolating it to prevent damage to surrounding organs. Second, to cool the sterile inflammation that naturally arises during trauma processing. Since weak mitochondria can no longer support healthy metabolism, water waste builds up and inflammation becomes necessary to clear it, just like the sterile inflammation seen in surgical wound healing. Third, the unprocessed fragments of trauma hologram may be discharged in the pleural field, waiting to be removed by urination or thoracic drainage. If the trauma hologram remains trapped, unacknowledged or unreleased trauma, then pleural effusion may recur. This approach places ankle edema, often seen in congestive heart failure, into a very different context. During stress or inflammation, blood viscosity increases. This is basically a stress danger response. Red blood cells begin to aggregate into rouleau formations, possibly because they are required to carry more electromagnetic charge from the heart, the physical imprint of emotional trauma. This sludged blood is more difficult to circulate. Clinically, this can often be seen as distended sublingual veins on physical examination, what some literature refers to as blood stasis in traditional medical systems. In congestive heart failure, different organs may struggle with processing distinct emotional aspects of the same traumatic life event. The liver may express anger, struggling to support the weakened heart. The heart may be overwhelmed by grief, unable to process the full emotional impact. The spleen and pancreas may fail to digest the emotional burden. The kidneys and adrenals may become exhausted by fear of the future, what is often called adrenal fatigue. When these organs collapse energetically, their corresponding meridians weaken, creating interference patterns that destabilize blood flow. The result? Structured water breaks down into bark water, which may pool in the ankles, the lowest gravitational point of the meridian system. In our model, the same interference pattern can also appear in headaches, but since there is much less space for water pooling in the skull, the excess energy builds up as pressure and pain. Amiodarone is often used as an emergency antiarrhythmic, especially intravenously, then followed by oral administration. It is unique in that it is the least negative inotropic option, which is crucial for patients with impaired ventricular function. In conventional terms, it is classified under the Vaughan-Williams system, combining sodium, potassium, and beta blocking effects. This explains its surface level activity, but not the full range of side effects, particularly during long-term use. A deeper explanation comes from the observation that amiodarone induces autophagy, a self-cleaning process to remove cellular debris. From a field perspective, this debris may represent the physical imprint of emotional trauma stored holographically in the heart. Clearing up it may help restore the resting gel membrane potential in cardiomyocytes and reset the heart field. The rest of the molecule, especially its heavily halogenated structure, resembles other spasmolytics or even volatile anesthetic agents. According to Pollack's work, these substances destabilize the structured water grid, which may be essential for consciousness and squid-like coherence in the cell membrane. Even mainstream medicine admits that volatile anesthetics may produce loss of consciousness by reducing membrane surface tension. We propose this model be extended to include EZ or structured water grid collapse as a key part of long-term toxicity. So, on the long term, if amiodarone disrupts the field repeatedly and the trauma imprint remains unresolved, the EZ structured water grid may rebuild itself incorrectly, leading to chronic sterile inflammation locally and eventually hepatic or pulmonary fibrosis. Levosimendan is a brilliant anti-arrhythmic and calcium sensitizer with positive effects on mitochondria, all achieved without overloading the EZ structured water grid around cardiac membranes. It marks a step closer to herbal pharmacology, which tends to work on multiple systems simultaneously, stimulating mitochondria, clearing waste, cooling sterile inflammation, and releasing overcontracted, overcharged membrane tension. But here is the limitation. Synthetic molecules lack field intelligence. They don't adapt. They can't tune their sensitivity to mitochondrial state, nor can they rebuild the EZ structured water lattice over the long term. They cannot provide a scaffold to it. Since Albert Szent-György's work on muscle contraction back from 1956, it has been proposed that muscle contraction is not just a mechanical action. It is a coherent interaction between electrons, protons, light, and the EZ water matrix surrounding troponin. After emotional trauma, this coordination breaks down. The troponin field becomes distorted. Levosimendan acts as a field conductor. It's nitrogen-based and on course into the water lattice. Its aromatic core resonates with light. This allows photons to collapse stored protons, triggering a coherent contraction field without any excess calcium. It doesn't stimulate force. It restores order. And this order is exactly what the heart needs. While our synthetic drugs are brilliant in the short term, the long-term picture can become increasingly complex. This is often where herbs come in. They act more slowly, but also more steadily and gently, often with a favorable side effect profile. There is a natural urge to blend these two systems together. But for this integration to work, we must understand how herbs interact with the EZ water grid, the same platform through which all biological processes may unfold. Nature's pharmacy is less influenced by pharmaceutical interests and more aligned with the long-term dynamics of structured water and field intelligence. As we begin to explore this water-based grid in greater depth, we gain a new lens through which to view everyday clinical practice. Our ultimate goal is to understand how even Western drugs function in the same EZ-based model of the human body. This shared biophysical platform may be the key to reconciling the synthetic mirror of the last 50 years with the ancient organic wisdom of herbal medicine. course, we are fully aware of potential drug-herb interactions. That is why, in this case, we have chosen a Sheng Mai San variant as our base formula, a well-known herbal combination that gently supports cardiac function and Qi bioelectrical stability. To this base, we add selected herbs to enhance microcirculation, support trauma release, and reduce the risk of sterile inflammation and fibrosis. As always, safety comes first. We start with low dose, only during the daytime, and carefully monitor the clinical picture. If the patient tolerates it well, the dose can be slowly increased until we reach the desired therapeutic effect without triggering unnecessary side effects. As described through this presentation, the common ground between herbal and synthetic medicine lies in understanding structured water grid. Whether natural or laboratory made, every molecule must interact with this fundamental biophysical platform. And here is the truth worth repeating. Nature's pharmacy does not care about business interests or scientific dogmas. It works as it works. We hope this presentation offered a meaningful field-based perspective on congestive heart failure. A view in which the cell's water gel matrix, the membrane, and the conscious electromagnetic field form a living, responsive interface, a sandwich we are just beginning to taste again. We also aimed to show how synthetic drugs and herbs can share common ground, and how, in the case of antiarrhythmic therapy, herbs can support and stabilize the body to improve outcomes. If you found this content useful or inspiring, we hope to see you again in the next video.